experts warn that delaying routine dental care can quickly lead to cavities, pain, and infections that affect a child's health, development, and of course, daily life. So joining us now to share the best practices for a child's oral health is Dr. Thomas Eisen, president of the American Academy of Pediatric Dentistry. Good morning, Dr. Eisen. How are you doing?
I'm doing just fine. Good morning. Pleasure to be here.
Awesome. I'm so happy to be talking about this because, dental health, well, health is wealth, as I said, and dental health is very important. So when should a child have that first dental visit? And, what happens then if you forgo that visit at an early age?
Sure. So the American Academy of Pediatric Dentistry recommends that a child have their first dental visit by their age 1 birthday. We know that if a child gets into the dental office early, before they have any dental problems, we're able to help parents develop healthy habits for taking care of their children's teeth and to have a lifetime of good oral health. We also know that if children are delayed in getting into the office, if they're age 3 or 4, they are much more likely to have dental problems such as cavities and then require lots of treatment maybe to fix those issues.
That is surprising to me because, before their first birthday, I don't know when babies' teeth come in, but usually it's just gums. But so get them in by that first birthday. And even if you wait just 3 years, you can have cavities. That's crazy to me. So Dr. Eisen, would you mind sharing some best practices for parents to, have when it comes to their children's oral health?
Oh, absolutely. Well, let's just begin with the basics. We want to keep the children's teeth clean and healthy, and so that starts with brushing their teeth twice a day with a fluoride toothpaste, and we want to brush for 2 minutes. 2 minutes, and the parents need to be the one doing that. The children just won't have attention to detail for taking care of those teeth. So morning and at night, right before they go to bed, brush the teeth, and then we want to floss at bedtime after we brush the teeth. That cleans the areas in between the teeth. And then the second thing we need to think about is what we're putting on the teeth. So we want to choose healthy foods, healthy snacks for children. We know that children who have 3 or more between meal snacks a day are much more likely to develop cavities. So we want to choose healthy snacks such as whole fruit or cheese. And we want to avoid really sugar-containing things such as juices, sports drinks, or fruit roll-ups. And don't be confused by the label organic. Organic may mean that the fruit is healthy, but if you're giving them organic juice, there may be lots of sugar added to that. And so we're putting lots of sugars on the teeth.
Ooh. Okay, so what can parents do then at home to help prevent those cavities we were just talking about?
Yes, so with the good brushing, the good flossing, that takes care of it. We also want to use a fluoride toothpaste. Fluoride in the toothpaste is the most cost-effective manner of preventing cavities. That fluoride soaks into the outer layer of the tooth, makes it stronger, helps prevent cavities. Anytime that you eat or drink something with sugars or carbs, the bacteria in the mouth turns that into acid, and that acid attacks the tooth. That fluoride makes the enamel or the outer layer of the tooth stronger, and it can even reverse early stages of cavities through a process that we call remineralization.
Okay, and why are good oral health habits, early on so important to just overall health throughout the lifetime?
Well, you can't have good overall health if you don't have a healthy mouth. And if a child has cavities and if they become painful, it can really affect their overall health. It may affect their ability to eat or drink, and so that can affect their nutrition. If they're having toothaches in the night, it may affect their sleep patterns, so that can affect their health. And then we also have to think about some social issues. If a child has a toothache, they may not be able to concentrate at school. And we know that children miss a lot of school because of dental problems. Over 34 million school hours are missed each year for children having to have dental problems taken care of.
Wow. Another thing I didn't know. Very good to keep in everyone's back pocket. And just to get more information and this information we covered today, where can our viewers go?
Sure, the AAPD's website, mychildrensteeth.org, mychildrensteeth.org.
All right, Dr. Eisen, thank you so much again for your time and all this great information today.
Thank you. Happy to share about Children's Dental Health Month.